Liverpool Health Partners is an interesting concept. It's a vehicle through which we can deliver innovation and science research to where it's needed on the population. With Liverpool Health Partners we have a chance to bring in investment into the city region and beyond, and to make sure that research really does make a difference to the population that we serve. In the past, the NHS has had a patchy track record of innovation. It's taken us in some cases decades to get proper evidence into practice. So for instance, we knew aspirin saved lives, but it took 20 years for it to be the first choice prescription to prevent strokes and heart attacks. We can't afford to wait that long to get the right evidence into practice. Putting Liverpool Health Partners together means that we're closing the gap between the front line and the academic.
The population locally stands to gain an enormous amount by having a focus on health endeavour and innovation on its doorstep. In terms of research and academic enterprise, there's a lot that can be shared. You'll have heard about the Joint Research Office, joint educational endeavours and so on. So the infrastructure that can work across all trusts and organisations can share a lot of resource and reduce costs.
We have really good academic health science researchers here in Liverpool Health Partners. We need to be able to use their expertise and knowledge in a way that influences primary care to become research optimistic, more than that perhaps research ready to take on the work that's required to bring in the investment to go for the best treatments possible for the population. The spin-off, of course, being that by getting involved in something that is so cutting edge and so challenging, we develop as practitioners ourselves at the front line, so it's a benefit for all concerned. Looking ahead, my hopes for the future of LHP is that it can act as a catalyst for the system change and service redesign that's necessary, so that the population gets the healthcare it needs. And that transformation isn't going to come about with multiple organisations working in different ways. We need to have that academic rigour, that health science applied to our healthcare services, and only then will we stand a chance of having the design that's required in order to bring about the changes needed.